Hi, folks. It's been a long day and it's allergy season, so my eyes are really bothering me. But I really wanted to talk to you real quick about an important topic because I saw somebody today who was suffering from pulmonary embolism. And when she first went in, they did not detect it. And unfortunately, it commonly happens that people have blood clots or pulmonary emboli in their lungs. And the first time they go to get it addressed, it's not found for various reasons. So, quickly, this woman was morbidly obese, and sometimes there are cases where people are either overweight or pregnant, and it's just chalked up to that being the reason why they're having certain symptoms. So I just want to educate you guys really quick on what pulmonary embolisms are. A pulmonary embolism is a blood clot that is in the lung, and it is life threatening, and it can be caused by various reasons. Most commonly it's immobility. So for instance, if someone's on a long flight, maybe overseas, and it's 8 hours or more and they're not really moving around much, that can cause blood clots to develop. And they usually start as deep venous thrombosis in the legs and travel up to the lungs. So it's important, if you're going on a long flight, that you get up every hour, walk around the cabin, of course, when it's permitted, and try to keep that blood circulating. Because remember, what I say as an example is immobility, or a body without movement, is like a stagnant river collecting sediment and waste. And as you look at a river, when it stops flowing or maybe something is blocking it, you can see all the debris and waste and slime that accumulates. So think of your blood or your circulatory system that way. When we're moving, our circulation is flowing, it's less likely that clots will form. So just keep that in mind if you're traveling or you're going to be going on a long trip where you know you'll be sitting for a prolonged period of time. Make a conscious effort to get up, or if you're driving, get out of the car, walk around, take a break. Okay, it's very important. Another symptom is shortness of breath. Another symptom is rapid heartbeat. Excuse me. Another symptom could be coughing. Now, sometimes chest pain. Now, the cause of pulmonary emboli beyond immobility can also include cancer, which makes your blood hypercoagulable or thicker, so it's easier to clot. It can also be caused by trauma or surgery. Our body produces platelets that go to a site of injury to form a blood clot to heal. So, for instance, when you cut yourself, platelets go to that area to help it stop bleeding so you don't bleed out. Unless, of course, you have some type of bleeding disorder like hemophilia, our platelets are there to help us heal. So, if we have trauma or surgery, sometimes that response can lead to blood clots. Now, that is why people are often put on blood thinners after surgery to prevent blood clots. And that segues to treatment. So usually it's anticoagulants or blood thinners to treat pulmonary emboli that you'll be on for a course of 3 months or more, depending on how you respond to the treatment. And usually you'll get that course prescribed by your physician. And in severe cases, they might do another imaging study to see if it's fully cleared before they stop the medication. And that is pretty much it. So if you're experiencing any of these symptoms and you know your body and something isn't right and you've gone to get checked and you haven't gotten an answer, just think of this. If you've been in any scenario that could possibly put you at risk for a pulmonary emboli. Pregnancy is also another one, being on birth control and smoking. So just keep those things in mind. And I wish you guys well. If you're suffering with symptoms from pulmonary embolism, seek emergency attention. And also, I want to, as always, invite you to join me at Freedom Wellness Physiatry, where we believe quality of life is not a daydream but a reality. If you're a caregiver to a loved one who is severely debilitated and desire to achieve increased mobility, function, and quality of life at home, I invite you to visit us at www.freedomwellnessphysiatry.com or call us at 240-339-5377. You can book a discovery call to see how the Freedom Wellness Physiatry experience can help you take control of recovery and fitness to living a more purposeful, meaningful, and well-balanced life with restoration and just the joy of living restored again. And click the link below. I have a expert guide that I'd love to share with you as a thank you, where you will learn the 5 pitfalls of post-hospital care and how to avoid them. All right, have a great evening. Bye-bye.